Yeah, we have a no-gene attitude at my work.
Oh. Well, and it's not Friday, so it's not like casual Friday.
No, even then, no
Do
genes.
that.
Patients don't like the idea that you're
No.
casual in a hospital.
No, they
And
want.
neither do their visitors. They want everybody to be ready to go every day.
Yeah.
Yeah.
I was just over at St. Joe's. My aunt had a lot of stomach surgeries.
No.
You know, so she finally made it out.
Oh, good.
But gosh, that hospital. I mean, because I'm a native,
Mhm.
so my husband was born there. I was born at Mesa Lutheran.
Oh, wow.
And my
Yeah.
daughter was too, but before it closed, you know.
Uh-huh.
But St. Joe's has changed. Oh my gosh! I mean,
Yeah.
I was
Well,
impressed.
wait
I
till the
like it.
locals get or the long-term folks get a look at what Good Samaritan's going to do. Because, you know, they've had that spaceship-looking tower.
Oh yeah.
I've only been in the community 21 years.
Oh, that.
But that spaceship, you know, that was like the first thing I saw. Before I worked at Joe's, I came in to go to a conference, and it was over by Good Sam. And those portal windows, I mean,
Yes.
that's really...
Oh, I know.
Yeah.
I went there when I sprained my ankle. I went to St. Mary's High School,
Mhm.
and I sprained my ankle at volleyball, and went to Good Sam, and I always remember, those little portals, and I mean,
Yeah.
that's been
Yeah.
around.
Yeah, so they're building a new tower, and they're losing that look.
Yeah.
So that'll be interesting. But we have, you know, added a lot of buildings, and
You
they
have.
moved the entrance from where it was on Thomas down further and recessed it. And I can barely find my way around some days.
And the parking's always an issue.
Well, it shouldn't be in Phoenix, but it sure is for us.
Oh.
Other hospitals have more space for parking, but we're real constrained.
Yeah.
We park our staff off-site.
You do? Do you have to bus them? Do you have to park somewhere and bus them in? Wow.
We shuttle some and some walk. The nurses, they're a sassy group. They mostly walk. I was a third of a mile away when I parked off-site and I walked.
Oh.
It's kind of nice way to start your day.
Well, and our weather is
Yeah.
conducive
Yeah.
to that.
Yeah.
Even when it's hot, it's
Yeah.
not bad in the
Yeah.
early mornings.
Yeah, well, particularly for nursing.
Yeah.
It's an early start.
Yes, it is.
Yeah.
Yes, it is. And odd hours.
Yeah, odd hours, odd people.
Yeah.
All good.
I'm ready when you are.
Okay.
All
Just
right.
make sure there's no glare on your glasses.
Okay,
We're good.
perfect, thank you.
All right, I know
Because
it.
I have to wear them, or otherwise I'm not myself.
For editing purposes, let me just have you say and spell your name for me.
All right, so my name is Julie Ward, Julieward.
And what would you like your title, your official
I'm the
title?
Chief Nursing Officer at St. Joseph's Hospital and Medical Center.
Okay. Well, first of all, congratulations for this
Thank
award.
you.
Oh, were you surprised?
I was surprised, yes. It was very, very nice.
Well, it was well deserved. I mean, looking at your current job, and I'm going to get to what Bridget talked about, you know, going beyond of what you do normally. But tell me a little bit about what you do normally.
So my job as the chief nurse, and I always tell the patients, is I'm the nurse in charge of nursing. So my job is to make sure that the patient care at St. Joseph's is as good as it can be. And we do that work through nurses, physical therapists, occupational therapists, speech therapists, and respiratory therapists. All of those are part of the nursing division. So we represent about half of the FTEs at St. Joe's. Half of the employees at St. Joe's are in the nursing division.
What would you say is if you can, the number one thing you like about your job?
Well, I think the variety and the people contact. I love the people contact. So my number one responsibility at work is to be sure that the patient care is safe and that the patients like the care they're receiving. So that requires a lot of interaction with people. I always say that you can't do my job unless you really like patients, doctors, and nurses. Because if there's one of those group you don't like very well, you're not going to be able to enjoy the job.
Yeah, and that makes sense. That definitely makes sense. What would you, moving beyond your job and touching upon what the things that you wanted to touch a part of, like the March of Dimes, talk to me a little bit about your work. Tell me a little bit about what you have done in that area.
So one of the reasons that I was considered for this award was the work that I did in the community with the March of Dimes. So the March of Dimes has a ministry to help babies be born well and to be healthy. They want to ensure that every baby gets a full 40 weeks before they're born. So they want to end prematurity. And many people will remember that the March of Dimes started out with a mission to end polio. And they were able to do that, right? We don't have a problem with polio in the United States anymore. And that's spreading throughout all countries. No problem with polio. So the March of Dimes could have said, job well done, we're all done now. But they reinvented themselves. And the way they reinvented themselves was around prematurity and problems with birth, so birth defects. So the work that I did with them was to look at a specific disease called spinal bifida. And many, many years ago, the Food and Nutrition Services in the United States, the FDA, really said that we needed to fortify foods that women eat when they're pregnant, because we know that women need to have certain supplements in order to have a healthy baby. So we started supplementing bread and cereals. And I am totally blanking on with what. Oh, huh?
Folic acid.
Oh my gosh.
Folic acid.
All right, so I got to start that part over. Is that funny? So anyway, the Food and Drug Administration recognized that one of the reasons patients were born, or babies were born, with spinal bifida was because there wasn't enough folic acid in the mom's diets. So they very quickly moved to put folic acid in breakfast foods, cereal and bread in particular. And so we saw a dramatic drop-off of babies being born with spinal bifida in the Anglo white population and a little bit in the black, but nothing really changed for Hispanic babies. They continue to be born with spinal bifida. So people put on their thinking caps, what could be the matter? And as it turns out, Hispanic moms don't always eat breakfast cereals and breakfast breads. They eat tortillas. So we were able to move without too much delay to fortify flour tortillas, but we could not find a way to fortify corn tortillas. So the March of Dimes, through donations and research, led the way in solving that problem. So just recently, we were able to announce that now corn tortillas will be fortified as well with folic acid. So now, when you eat a breakfast of cereal or toast or tortillas, your baby is protected.
I just had my chorizo con huevo and tortilla this morning.
You're set. You're set then. The reason that they would not release it is that they couldn't guarantee it would work. They could put the folic acid in the food, but they couldn't guarantee that it would convert when you ate it to a higher blood level of folic acid. So they couldn't say that tortillas were fortified, because if they did, people would count on that and then maybe still have babies with spinal bifida.
You know, you certainly have a passion for what you do. Looking at your career, can you narrow it down to maybe, or pick one personal incident that has you doing what you want to do?
Well, yes, I can do that. So let me talk a little bit about how I was raised. So I had a mom and dad like lots of people, and my dad was a real hard worker. So he left us all with a great work ethic. My mom was a real hard prayer and a real hard volunteer. And she got us started praying and volunteering very, very young. My first memory volunteering with my mom was pressing dimes into a March of Dimes folder to donate for March for Dimes. And so it grew from that, my interest. And then when I became a nurse, you know, nurses are interested in all sorts of things. I started to work more and more with moms and babies. But what also happened around the same time is I became a grandma for the first time. And my daughter Jennifer gave birth to premature twins. They were born at 30 weeks. They were very tiny, a little over 2 pounds and a little over 3 pounds, a little girl and a boy. And it just so happened that I was doing a March of Dimes kickoff down in the lobby of the hospital while my daughter was up trying not to have those babies too early. And they brought us something called the Big Book. And in this big book is everything you need to know about prematurity if you're a mom. And so I took that book up to my daughter after the press conference, and we started looking through that book. What if the babies are born at 26 weeks? What will they be like? What if they're born at 28 weeks? What will they be like? So we read that part on 30 weeks, and that's ended up being when they were born, and we knew all kinds of things about what to expect that we wouldn't have known otherwise. And I was already hook, line, and sinker wanting to work with the March of Dimes, but that is my mission connection. That's how I became personally connected to the mission, is through those two tiny babies who are going to be 12 this year, and have many tiny babies have benefited from the March of Dimes work since then.
Now, how did you get involved with something else that you'd like to touch upon, human trafficking? Now, how did you get involved in that?
So human trafficking is actually part of my work. So that's not volunteer work that I do on the side. That's actually part of my work. So if you're familiar with St. Joseph's, you know that it's a Catholic organization, faith-based, and our mission is to promote the healing mission of Jesus Christ through particularly work with the poor and disenfranchised. So we started working with human trafficking a few years back when we were going to have a big sporting event in town, and we were going to be involved in that sporting event. Sporting events often bring an increase in human trafficking to a community, and we wanted to be sure that our staff knew what to look for. It might sound simple, but it's actually difficult always to tell if a woman or a child or a man is being trafficked. So we started to do a lot of education in our emergency department, and from that we have been able to develop a stellar program through all of Dignity Health. So all 41 of our hospitals have a human trafficking program in both their emergency department, in our mom and baby clinics, and in our mom and baby units, so that the staff know what to do. How do you best help a person who's being trafficked? Who should help them? What do you do when they tell you? What can you look for? So we started to look for those signs, and it's like many things. When you start to look for something, you see it. And so we were able to start to intervene, and I believe really make a difference in our community.
Have you seen it? I mean, have you seen a direct impact of I remember a few years ago, and I remember seeing the billboards all around town as far as bringing awareness to human trafficking, but can you give me an example of something that was prevented, or a life that was saved, or anything like that?
Well, we have definitely been able to reach out and help individuals who have come to us for another reason. So maybe they're in a traffic accident, but their behavior fits the profile of someone who's being trafficked. Then we have a protocol that we follow to gain the trust of that person, to give them time to tell us that they need help. Once they let us help them, then we have a protocol for how we're going to help them, how we keep one person with them the entire time. Often people who are being trafficked are not ever allowed to be alone. There's always someone with them. And so that's one thing that we might look for, is a patient that's never allowed to talk to us one-on-one. Another thing that might happen is they might have multiple phones. And when one phone rings, they ignore it, but when the other phone rings, they always pick it up. So we look for that phone pickup, and then the inability to talk on their own, always looking at someone else before they answer a question. That can be a sign that there's a problem. So then we work with the nurses and the social workers, and we work with the community to find safe placement immediately, so that person does not have to go back into an unsafe situation.
Your plate is full.
Yeah, it's a little full. It's fun.
What's the most rewarding part of what you do?
Well, it's very rewarding to see people get well. I think that's very rewarding. In my job as the chief nurse, it's very rewarding to see nurses grow. So when a nurse starts in an organization, knows very little, is maybe very afraid of the work, and then becomes a confident nurse that can handle any situation and that looks forward to coming to work every day. I think that is probably, that and the patients are the tie for what makes me the happiest.
How important do you feel the work of the YWCA is right now?
Well, the YWCA is a very, very interesting organization, and it's a lot like the March of Dimes, because they are not who they were 50 years ago. When you think about the YWCA as a child growing up, I thought about going for recreation, maybe taking a sewing class, those types of things. But now they're out in the community, feeding the elderly, even feeding the pets of the elderly. So they've reinvented themselves to mirror the needs of our community. And I admire that. I think that the YWCA has done that I think March of Dimes has done that. I think St. Joseph's has done that. Agencies that stay relevant in our communities change to mirror the needs. And I think that's what we have to do in the nursing division too. We're not the same as we were in the 1950s. We also have to change to meet the needs.
Speaking of nursing, like you said, back in the 1950s, you didn't see men nurses too
No,
much. When
that's
you hear
right.
nurse, you think of
Yep.
a female.
That's
so
right.
how is that changing?
Well, it has changed, and at St. Joe's we have about 11% male, which is higher than the national average. So more guys are coming into nursing. They have a tendency to go into not the mom and baby units, but the ER, interventional radiology, places where you get to get in and do things. And so we do have 10% of our nurses are men, probably about 200.
When it comes to the equality for women, whether it be pay, position, where do you want to see that go? I mean, we have come a long way, but we still have a long way to go.
That's right. And I think we have to always pause and celebrate what we've already accomplished. I think it's discouraging sometimes to only look ahead of what needs to be done and not take that pause to look at what has been done and continue to celebrate that. To me, that is what the YWCA does so well, is they celebrate. They celebrate their accomplishments. And I think all great organizations pause to celebrate and look at what has been done, not just what needs to be done. But you're right, there's still lots and lots of work to do. But I would say we've come a long way, baby.
We have. And what was it like growing up? What types of encouragement? I mean, were you ever told you can't do it because just women don't do that?
Well, yes, definitely. I think growing up, I was raised in a very traditional family, a Catholic family. Girls became three things: nuns, teachers, or nurses. I wanted to be an airline. I wanted to be in the Air Force. I wanted to be a pilot. And my dad said, no, thank you. You are not going to be a pilot, and you are not going to be in the Air Force. And I really kind of grew out of that. My brother was 12 years older, and he was in the Air Force. It seemed like a really good idea to me. So I would ride my little unicycle up and down the sidewalk and think about being a pilot. And then I grew out of that role and thought more about healthcare environment. So I think that my parents they didn't get the opportunity to go to college themselves. They wanted that for all three of their kids, and they were able to help us accomplish that. And so their goal for me was a college education, and we were able to meet that together. But I did not get to join the Air Force. Today I probably would, but in 1960, when we were talking about it, that wasn't going to happen.
Nursing seems like something you were drawn to, more so than just it's one of the three things you have to be, but you were naturally drawn to that.
Yes, I was, and it was a little bit shocking to my family that I wanted to be a nurse. I couldn't even read a thermometer. I never really understood that part of the thermometer about how you twist it to get the little silver line, and then you look at that number. So I had my kids before I became a nurse, and I would just decide on my own whether or not I thought they had a temperature. And so I probably would have been referred to as a hippie back then, or maybe holistic medicine today. And so they were very surprised. They didn't think I could even figure out how to take a blood pressure. But it turned out to be the work I was born to do. And not just to be a nurse, but to be a nurse leader. And as I come to the end of my career, I know that to be certain, that I'm in the right job doing the right work.
If you had a crystal ball, or if you could create the future, what would you consider an ideal future? Whether it be medically, in your field, or from a community service standpoint. But if you can,
Well, to answer just a little tiny bit of that, what I would say is that people who care about people and agencies who work to help people in the future need to do more and more to help them take care of themselves. So in healthcare, we talk about a concept called an internal locus of control versus an external locus of control. And I think as time marches on, we have to find ways to unlock that internal locus of control in people so that they take better care of themselves. We tend to create systems for people that take care of them. And I think we have to find a way to empower them to first partner, but then empower them to have that internal locus of control, that drive to exercise and eat right, and not smoke or drink excessively or drive drunk. We have to get everyone to want to do that and unlock that inside themselves. And to me, that's the future of agencies like the YWCA, empowering people to be their best selves.
Well, you're your best self. You're a role model for many women out there.
I
people
do
in
try to be
general.
my best self, but doesn't happen every day.
Well, congratulations
Thank you
again.
very much.
Do you have anything, Bridget?
I think that was awesome.
Oh, good.
Awesome, yeah.
All right.
On your
Thank you.
chapter.
You just are a great interviewer.
Oh, well, thanks.
Yeah.
I do like to talk. No, I'm just kidding, but you're doing most of the talking.
Yeah, I know you were very good.
I've always asked too many questions growing up.
Well, that's why they edit, right?
Oh, yeah.